Hi everyone, Dr. Samina Mitha here, as most of you know, but for those of you who are new here, I wanted to come on here and introduce myself. I'm a naturopathic doctor who helps women with PCOS, specifically manage their weight, regulate their cycles, reduce inflammation, all without feeling overwhelmed and frustrated and without giving up all of your favorite foods. I'm so happy to be here chatting tonight about ovulation. This is something that is near and dear to my heart because I also suffered with irregular cycles and sometimes still do. And one of the questions that came up this week was, what do you do when you've been told that you're not ovulating? And honestly, I've been told this many times and I actually am ovulating just later. So one of the things that I found when I was working in a fertility clinic, that every single patient was being tested for ovulation on cycle day 21, and this just does not work for women with PCOS. I even questioned the nurses that were there, and they just said, this is just what we do, and it makes sense. On a 28-day cycle, around cycle day 21 will be 7 days post ovulation because you'll be ovulating around cycle day 14. But in a patient who has PCOS, you might be ovulating on cycle day 20. So if you test the progesterone on cycle day 21, it's going to look like you haven't ovulated. So it's actually more important to be looking at what does the actual period look like. And the biggest thing is if you're getting a full flow period, and not this period where like you can use one pad for the whole day or like just spotting, that is a really good sign that you're ovulating. You might just be ovulating later than that. So that's the number one thing I want to give you today. But also know that one of the biggest reasons why ovulation isn't happening for a lot of women with PCOS is because the underlying root cause is insulin resistance. When we have higher levels of insulin, this can actually increase testosterone. And when we have higher levels of testosterone, it can block the production of estrogen. And we need estrogen to be high around ovulation so that the egg can come out of the follicle. And so that LH can rise and so that we can get ovulation going. So if you are suffering from PCOS, you've been told your blood work looks okay, your glucose looks perfectly fine, find someone like me or me to help you figure out if insulin resistance is present, because sometimes on blood work it doesn't look clear, and it takes a really good professional, I think, who's really entrenched in PCOS to really determine if insulin is present. I have so many articles on this, like skin signs of PCOS or insulin resistance on my blog is a really good one that will give you a good starting point. And also come to my webinar next week. It's it's on Wednesday, June 14th. Yes, I keep thinking it's 13th, but it's 14th, 6:30 p.m. Eastern Standard Time. I'm going to be talking all about insulin resistance and giving you some things to really rethink when it comes to PCOS. So I really hope you'll see me there. And I'll drop the sign up link below so that you can take a look and check it out. Hope to see you there and have a good night.